Without further ado, good morning, everyone. I'm Kirby Nestor, Vice President of the Engineering Alliance Minnesota. And on behalf of the Alliance and its foundation, welcome to day 2 of Beyond the Pandemic, a virtual summit on innovation in STEM. In our jobs, many of us are wrestling daily with the challenges of the pandemic and helping our state, our nation, and the world move beyond it and move forward successfully. The hope we all share for moving beyond the pandemic led to the development of this STEM Meets the Challenge of the Pandemic Outreach Series and Summit. And it is that hope that is bringing so many of us together from across the STEM ecosystem in Minnesota and beyond for this event. Yesterday, you heard from STEM professionals who are leaders at Medtronic, 3M, IDOM, WSB, and more. You heard from STEM students and educators who use their creativity, their contacts, and in some cases, their 3D printers to create much needed protective gowns and face shields for healthcare workers. Today, we'll hear from epidemiologists, civil engineers, and people who are working to build a stronger, more diverse STEM ecosystem for the future. We'll hear more about the urgent work that STEM professionals are doing to keep us safe during the pandemic, and the equally important work going on in corporations and advocacy groups to develop a more diverse STEM workforce for the future. You will see how many of us are working in new ways to move our response to the pandemic forward. And you'll see how those new ways of working will help us better meet the challenges of the future. Our sessions today will be recorded. It took a dedicated group of presenting sponsors, supporters, and contributors to make the STEM Meets the Challenge project and this summit possible. Thank you. And without encouragement from Michael O'Connor, Medtronic's Director of Strategy and Project Management, we might not have gotten this project off the ground. Thank you, Michael. And thank you, Katie Jameson and Beth Murphy, the dynamic women who took that encouragement and turned it into the STEM Meets the Pandemic project in this virtual summit. I'll turn it over to them now. Beth?
Thank you, Kirby. I just wanted to take a minute to share some of the resources that you'll find online related to this project, in case you haven't seen them yet. A really big effort was made to help fill the role model gap that was created because of the pandemic. Scientists and engineers were no longer able to go in and visit classrooms and after-school clubs, be in-person mentors on robotics teams and things like that. And so everything was happening virtually. And we wanted to ensure that today's young people still had the chance to learn about STEM careers and discover people who were inspirations. So 25 different individuals from across all different kinds of STEM related fields participated in Zoom interviews and that were condensed down to 7 to 10 minute interviews that are available on the STEM Leads the Way website. We also on this website have tips for educators to be able to use the resources in their classrooms and with their students, as well as all of the people that were interviewed talk about how their work changed the problems they were solving, the new ways of working that they engaged in that were introduced because of the pandemic. So it's a very exciting resource and we hope you take advantage of it. The other thing that you'll find on this website is a blog, and we're eager to have posts from everyone from the STEM ecosystem sharing in this and continuing the conversations that we're starting today and yesterday. So there's a form that you can go ahead and post an idea for a blog post, and we'll get back to you and we'll help you with the whole process of making it go live, and also with getting it out on social media. And feel free to please go in and read what's already there as well. We hope to continue this conversation after today. Thank you. Katie?
Thank you, Beth. Most importantly, it's really been an honor to work with Beth on this project. We identified last fall with a group of us that there was an opportunity to serve our STEM community during this school year, and we had a fantastic collaborative task force that came together to share some ideas. And this is what happens when we work together. So we're pleased to invite or to have you all with us for this summit on day 2. Yesterday, we had some great new connections, some content conversations, and we really look forward to continuing this beyond these 2 days. So I hope you take a minute to make a new connection throughout today and learn something new, bring some ideas back to your organization, and most importantly, continue identifying the ways that we can build our STEM ecosystem in Minnesota and beyond going forward. Earlier in this project, I had the opportunity to interview Dr. Mike Ulsterholm about how he got into STEM. So we have his full interview on the website at stemleadstheway.org. If you haven't had a chance to watch it yet, it's a fun video to watch. And I did play this yesterday, but we have some new people joining us today. So I'd like to take a minute to share this with you. It's just a quick answer to the question I asked him about what he would share with kids who are considering a career in STEM.
Sometimes people are intimidated by the concept of being involved with STEM. They feel like, oh, it's too difficult. I can't understand it. I won't know what to do. How do I compete? Don't let that happen. Let yourself try it. Get involved. And it may not be one element of science that, for example, is your forte, but another area might be one.
Oops, sorry, I clicked to let Tricia in. Hold on 1 second.
The person who is out working in the field with wildlife, tracking down moose, working on that, they're very different than the person who is in the laboratory dealing with viruses and bacteria. Surely their subjects are different size, but when that virus or that bacteria kills the moose, or even infects humans, suddenly that laboratory and that virus and that bacteria that scientist has been working on, they all come together. They all are part of the team. And so I would just urge you to see the fact that if you're involved with STEM, you'll never be alone. You'll never by yourself basically have to solve all the problems of the world, but you'll also have an opportunity to do great personal things that could, in fact, very well change the world with just one discovery. So please get involved.
All right, and this is just a quick overview of our schedule today. So we are day 2 of our summit. Some fantastic sessions coming up today. If you need to reference this is on the main page for the what are we at? We're at the summit on the website. So this is where you can double check the schedule. And I want to acknowledge again the people who helped bring this project together. We had a fantastic collaborative task force, some great project consultants helping us, and thank you to everyone for being part of it. We also had the opportunity to bring in 2 college students to help put the videos together and edit them. So it was really fun to get to work with them and give them an opportunity to do some work while their college years were looking very different this year. And with that, I will let the president of our foundation, Chuck Clanton, say a couple words, and then we will give you guys a chance to get to meet a few other people joining us today.
Thanks, Katie. I'm president of the Engineering Alliance Foundation here. We're the not-for-profit side of the Engineering Alliance. And our mission statement here deals with higher education scholarships and K-12 STEM education. So this fits exactly within our mission statement, and we are very pleased and honored to be able to partner with Katie and Beth and their program on putting together this STEM pandemic challenge here. Would like to recognize and acknowledge the 3 major players in helping getting this started, and that's Medtronics, 3M, and then Boltman and Mink. And I mentioned yesterday that when you're shopping at the big box stores here for your pacemaker, consider Medtronics for that. Plus, I found out yesterday that they got 174,000 different products on the market. So when you're out there shopping, sounds like wherever that big box is, they're going to handle all of your human plumbing needs there with them 174,000 there. So The other thing I was thinking about, if you're picking up a pacemaker, you might want to get a second one, you know, because you want to have one in reserve in case that first one goes out. And my dad testifies that at age 94, he's on his fourth one. So they don't last forever. Now, remember to pick up all that tape there, the 3M handles in that big box. And then as you get from point A to point B, Boltman and Mink's in charge of those bridges and roads and infrastructure systems. So keep those three in mind there when you're running around. And then there's some other players and consultants in higher education and some clubs that contributed there. So we appreciate all that money coming in and the sponsorship. And then a big thanks for putting us all together between Katie and her company on Engage, developing communities for nonprofit. And then big thanks for Beth and her expertise in STEM education consulting there. So with that, back to you, Beth and Katie.
Thanks.
Good morning, I'm Randy Ellingbo, and I serve on the Engineering Alliance Minnesota Foundation Board, and I am also a licensed civil engineer, now retired though, as manager of the Drinking Water Protection Section at the Environmental Health Division of the Minnesota Department of Health. And it is my pleasure to welcome you to your public health crash course, the Minnesota Department of Health Thursday keynote session. And our speakers today are two colleagues of mine from past life. They're Myra Kunas, Division Director of the Minnesota Department of Health Public Health Lab, and Tom Hogan, the Director of Environmental Health Division at the Minnesota Department of Health. Tom's also the Deputy Incident Manager in the Department of Health's Incident Command response to the COVID-19 pandemic. And he's responsible for managing the available response resources at the department during this emergency. Just a little bit more about Myra and Tom. Myra, as leader of the Public Health Lab at the Department of Health, leads one of the most highly respected laboratories in the United States. And she has to manage a program that's faced with ever-changing needs for analysis of chemical and biological threats to human health in water and air and so on. She has been a wonderful and thoughtful colleague to work with over the years. And Tom was my boss for a number of years as director of the Division of Environmental Health. And I got to see Tom in action in quite a number of crises. And he is the kind of calm and organized leader and communicator you want every day, but also in an emergency or in a tough situation. And I can't count both of them as friends. And so thanks for being here today. So to all who are watching, I invite you to submit questions during this session via chat, and then I'll moderate a question and answer session following the conclusion of the talk. So please welcome Myra and Tom. Thank you.
Good morning, all. This is Tom Hogan here, and I too just want to thank the Engineering Alliance of Minnesota for inviting us in, and especially Katie and Randy working with Myra and I over the last couple of weeks to bring us on board to this conference and summit. So really appreciate the opportunity to be in front of you today. And I also have to say up front, I think on the behalf of myself and public health in general, and all the citizens of Minnesota, thank you for all the efforts that you have done over the last year and a half in our efforts to control COVID-19. Maybe to start out with, I'll just put the disclaimer out there. Even though Myra and I are talking about public health, I don't think I don't think Myra either really has a background in what you would consider public health. So it's a pretty multifaceted effort when it comes to public health. So next slide, please. So what is public health? So the mission of the Department of Health is to protect, maintain, and improve the health of all Minnesotans. Contrary to what a lot of people think, that is not healthcare. We do a lot of data collection and surveillance and analyzing that data to help with kind of communicating about health issues and working on policy issues as we work to create healthy communities and families, save lives, and reduce healthcare costs. Next slide, please. So as Benjamin Franklin is quoted as saying, an ounce of prevention is worth a pound of cure. So about 75% of our healthcare spending is actually on preventable diseases like obesity, heart disease, and diabetes. And as an example, every $1 spent on childhood vaccines can save $16.50 in future healthcare costs. So this is where we get a lot of gains in our healthcare system when we can be preventable. And as you can see here, public health has really advanced our life expectancy since the early 1900s. Next slide, please. So a couple specific examples, and Randy is all too familiar with the first one here, with safe drinking water. You know, the advances that have come through science from the standpoint of disinfection and better protection of our water sources has really led to safe drinking water across the nation. And if you ever get a chance to hear John Anefson with the National Park Service, he has a really interesting talk about the efforts that went into improving the drinking water system here in the Twin Cities area. And just as a side note, in my little bit of historical digging, back in the early 1900s, people didn't find the water that was provided was safe to drink, made you sick. So for those of you who liked beer or whiskey, that was the preferred beverage back then. And we've really turned that around. What happens when we get lax in some of those activities? I think we all can remember back to Flint, Michigan with the issues with lead service lines when they switched their water sources and just really weren't prepared for the science and chemistry that comes along with switching water sources in a water system like that. And then second there, you know, smoking prevention. Through public health efforts, we've been able to reduce smoking in adults from 42% of adults smoking in 1965 to 19% in 2010. So just great advances that we get in public health. Next slide. So more specifically to COVID, so what was the health department? So MDH prior to COVID was about 1,600 employees. Really, like I said, a data and science driven agency that's gathered data to make decisions to improve public health. And that involved a wide variety of different disciplines, research scientists, epidemiologists, which we heard from Mike Osterholm, one of the worldwide known epidemiologists in the right here in Minnesota, medical and environmental laboratorians, engineers, data analysts, planners, communicators, and field investigators. You know, so it's not just all about the data. We have people out in the field gathering information as well. And then along came COVID-19. So of that 1,600 or 1,500 so employees, about 1,000 of those employees, we shifted their duties into COVID. And in addition to that, there's probably another additional 1,000 people from other agencies and contracted staff that have come on board to assist us. What that's resulted in is a lot of our kind of core public health work is kind of been put on hold for the last year or so, as we've really spun up the data and science part of our work as we look to deal with the COVID response efforts. So I'm going to turn it over to Myra to talk about the testing response that we've created here.
Thank you so much, Tom. And it's wonderful to be here. So as was mentioned, I'd like to thank Randy as well and Katie for the support and having us here today. So when COVID came on the scene, that was about December of 2019. And very quickly, the CDC worked on getting a test up and running. Initially, our public health lab was the only lab in the state that could perform COVID testing. And the first positive was detected on March 6th of last year here in Minnesota. And we were expecting, at max, maybe 300 samples would be needed to be performed, not just here at the public health lab, but just overall in Minnesota. That was really immediately recognized as a gross underestimation of the demands of monitoring the spread of the virus. And so within 2 weeks, our lab became fully overwhelmed. We went from receiving 100 at max samples a day to over 1,000 a day for a week. And just to give you a estimate, usually we'll get 200 samples for all of our tests that we monitor for. And so we partnered with the Mayo Clinic and the U of M as well. And that was the initial push to get COVID testing here in Minnesota to monitor the spread. And even that, being able to do about 20,000 additional samples a day, which started here at the beginning of May, just wasn't enough. We recognized that testing on a mass scale was needed. We initially were having to prioritize who was going to get a test and who wasn't going to get a test, which of course we lived through and realized that wasn't a good solution. This huge spike here in how many tests could be performed was when we brought on vault testing, which was a brand new lab here in Minnesota, and more community sites. And I want to point out one other piece here is what we saw early on, as I'm sure most of you know this, was a significant issues with getting supplies early on, and we still have issues with getting tips for pipettes. Something that seems pretty minor is a huge issue when you don't have supplies. And so we could do, 40,000 in September samples a day, but in reality it was less than 20 that we actually could do based on staff and supplies. As we've Tom mentioned, all of this is multidisciplinary. Testing only goes so far. You can see where it's at, but how to prevent, which is really public health, was a different focus. And so we at the Department of Health partnered with the U of M to model and identify areas where reductions could be made, interventions could be put in place to help curb the spread and help support our hospitals, the public, reduce deaths and sicknesses throughout the state. And so what you see here is just an infographic of what was included in the model. I have a link here also that you can check out some more information about that. And then that helped determine, again, interventions. Then data was collected with our epidemiologists doing contact tracing. So many people doing contact tracing and collecting that information and then sharing that data publicly. A big aspect that we've seen across the country. Some states are doing it differently than others, but really sharing the data and being as transparent as possible where we're at as a state, and then also as a nation. CDC has similar information that they're sharing. If you haven't checked out either of these sites, I highly recommend it. It has a lot of data that you can export, and that's another piece of this pandemic, is really trying to partner with other data scientists to curb the impact of this pandemic. Tom, I believe the next slide is back to you.
Yeah, thanks, Myra. So, a lot of data, and then how do you take that from again, looking at it from a public health standpoint and put that into something that's consumable, I'll say, to the, not only to the leadership of the agency, but also, policy makers, the general public, and the various organizations that we interact with. So, from a public health prevention measures standpoint, message, seems pretty simple. Keep your distance, hand washing, masking, and those are pretty simple things to do. And as we moved through our response efforts and learned more about COVID-19, we adjusted those messages to really kind of convey what's going to be most protective for people. And masking, I think, is one of those examples. Early on in the response, there was some skepticism even amongst the experts whether that would have an impact. And as you can see, I still kind of have something around my neck every day, just to remind myself that's an important thing. So, the science and the data, critical then to turning that into a component of what I'll say is the social sciences part of public health. And just kind of want to refer to Healthy People 2010 defines health communication as the art and technique of informing, influencing, and motivating individual, institutional, and public audiences about the important health issues. So I think COVID is just, again, we all got our crash course on the importance of communication and the right messaging as we move forward. And it really, in this instance, it's really a component of risk communication so that individuals can really make informed decisions to protect themselves and their loved ones in certain situations. It is an individual and community effort in a lot of ways, but on our part in public health and with our partners, we need to know our customer and what's going to help drive the customer forward to take some of those actions. It needs to be a simple message, and I often refer to our public information officer who has referenced that the average person, their attention span is actually less than a goldfish for an attention span. So, and I think that's even harder these days with our various social media and handheld devices that we carry around with us. But the social science of the education and communication out to people is important. And, part of that is how do we drive people to learn more about what to do to keep themselves and their families healthy, and also, when we can and when there are things to do, give them action steps that they can take to protect themselves. And I think that you saw that play out in our response efforts here. So I'll turn it back over to Myra.
Yeah, so vaccination obviously would it's kind of our way out of this pandemic and the current state, or at least it is the our next steps of this pandemic, and it was always going to be the fact that we have a vaccine, 3 vaccines in less than a year from the initial discovery of this virus is incredible. The science that went into that, obviously it was multi-pronged, a lot of financial support to make that happen, but we're seeing the benefits of that. Getting shots into arms is a whole nother response in a response. And I feel that at MDH and across the state with our local public health partners, it was truly another response. Going back to Tom's, the outreach to encourage people to get vaccinated, letting them know when it's time to get vaccinated. And then this here is the dashboard. Again, very data driven. It shows how many people, depending on where you click, have received 1 dose or fully vaccinated. And I'm guessing others don't do this, but I monitor this on a regular basis as a just indicator of where we're at. The governor, I know, monitors this on a regular basis. We've gotten to a point where we're at about 60% of those that can get vaccinated have. But we know that that's not herd immunity. And so we're trying to take next steps to get the vaccines where they're needed, instead of making people hunt them down, looking for appointments at 3 a.m. so that they can actually get the vaccine. Those aren't the ones that we're now looking for. And so as this pandemic has evolved, we have had to evolve with it. And that's the beauty of science, right? That's what we do. We change as the data changes and as the social aspect changes. And speaking of change, as we, our public health lab, as well as several others in the state, we've been monitoring the changes in the SARS-CoV-2 virus. And so earlier this year, we've really focused on variants, and specifically variants of concern and variants of interest, which that's the whole definition the CDC has. And this allows us to really look at what changes are happening and what variant is the dominant strain, not just in our state, but regionally, as well as US. And we also, CDC tracks that worldwide as well. And so our lab has been isolating the virus and running whole genome sequencing since 2 weeks after our first positive case. We are doing just a handful every week since then. And then the beginning of January, it became very clear that we needed to do more. And so we were doing just a handful, a couple dozen before that. Then it went to about 150 per week. And then we now, between 3 labs, I believe we're about 2,000 samples per week. And for whole genome sequencing, that's not a minor task. That's 4 or 5 days of direct working on a sample, isolating, doing all of the workup for it. But what that allows us to do is really, it is not for patient care at all. It is certainly for public health purposes. Because as the virus changes, there's the opportunity for vaccine breakthrough and other changes within the population and how we can respond to it. And so keep staying on top of that, isolating those as much as possible that come in contact with those variants, the ones that are most concerning. We do more contact tracing to ensure that it doesn't spread further. And we also do a mixture of both just statewide surveillance. So, get a smattering of positive samples throughout the state. And also, specific public health concerns by vaccine breakthroughs, hospitalized cases, outbreaks, things like that. And this is very common. We actually do this with other outbreaks, but because of the scale that we're looking at right now, we just have had to increase that whole process. Yeah. Tom, I'm going to pass it off to you as well. I could probably talk for another 20 minutes on the variants, but I'm going to stop now.
Yeah, coming into this, Myra and I were debating how we were going to control how long we could actually talk about various aspects of our response. And I know Myra has a great passion for the public health lab and the efforts that go on there. So, I think we're going to have some great time to answer questions as we go along. Again, my background, I kind of got a quality engineer in my background and was in environmental consulting for a number of years before, I'll say, really backing into public health, and in reality have never really regretted it. Certainly have been able to stay connected on the environmental side, being in environmental public health. But what I have found really fascinating and dynamic is what you see in front of us. So, the partnerships and relationships that public health relies on and fosters, I will say, kind of across the spectrum, and there's probably elements missing here, really kind of show the, public health really connects to just about anything in our society. And, I'll just kind of use an example. I told this to Myra a couple days ago as, excuse me, as we were setting up mass vaccination sites that the state is operating. And, even I just learned about this a couple of weeks ago. It's a team out of our state emergency operations center that set that up early on in our vaccination efforts, and kind of built off of what we learned from our mass testing sites that the state operated. So there's the obvious aspects of the medical aspects of it, and contracting for a site and getting supplies, the logistics of getting supplies there, and that type of thing. And I was surprised to learn we actually involved an engineering firm in laying those sites out. Just from the standpoint, if you step back and think about it, that's a process, and there's an engineering process that you can bring into that. to ensure, you keep the social distancing, you have the flow of people, and can kind of maintain that flow of work as we move forward. So again, I think public health, as you can see here, is a focal point. But I've always seen it as a great way to bring different organizations that maybe would not normally get together to solve issues, to bring them together to help solve issues for the greater good of public health. So next slide, please. So, public health is all about the science. And, hopefully you heard today the natural science part of it is kind of really core to our work in a lot of different disciplines within the agency. But along with that, there's the social science aspect of it. How do you take that information? How do you make it consumable for people? How do you package that in a way that's going to influence then the general population and even policymakers as we move forward? And that third piece, there's a political science part of that as well. And I think again we've seen that play out with the pandemic nationwide, and that kind of tails back into the social science part of it, and making sure our data and our information is transparent, as Myra indicated. Lots of data on our website available in a lot of different ways for people to download and manipulate themselves. So there's just a lot of great information there, and that's part of our role as public health servants, is to make that information available so people have that in their hands to make decisions. So turning it back to you, Myra.
So yeah, I think everyone, at least that I know of at MDH, is tired. We've been doing this for a long time. I've been in a few meetings where people, are asking for creative ideas on an issue, and our leaders, even above us, Tom and I, have said we're tired and we're no longer creative. And so, but that doesn't stop us. We are continuing to track the disease, track variants, when things spike, if they spike, hopefully not. We'll be there to do everything we can to intervene and educate and try to stop the spread. But we're also working on demobilization. So at some point, we will be moving from a pandemic to an endemic. And this is something that we do very well for as far as monitoring endemics, right? The outbreaks, our lab, our EPIs, this is what we do on a regular basis. We monitor flu around the state every single year, although this year was, thank heavens, a little bit slower. And really just regroup as an organization to lead public health in Minnesota for future. Going from 1,600 people to well over 2,000, I think about 2,500 or so, is a lot for an organization to take on. We also are there for our state and working to communicate differently to move our needle from a data-driven organization to one that does more outreach and more support to get our messages out. I think all of us feel like we probably can write a novel on this last year on the things that have happened, and to ourselves, to our staff, to our partners, and I'm very hopeful, and I do think this will happen. This will come together even stronger in the end. So Tom, do you have any other comments?
No, again, I think I would just emphasize the importance of our partnerships, the more obvious ones like local public health and local government and schools. But, as I've heard described, just a lot of great effort on the part of organizations involved in the summit here, really stepping up and responding. And that is truly an amazing response from many sectors and many people. And again, I think on behalf of the Department of Health and leadership there, just would thank everybody again for the efforts that you and others have put into helping us respond to COVID-19. I think we'll turn it back to you, Randy.
All right. Well, thank you, Myra and Tom, for the presentation, but also for your efforts and for the efforts of all the staff at Minnesota Department of Health to help us deal with the challenges of COVID-19 over the last months here. So we're hoping for progress as well, of course. And now for the audience, we have an opportunity for you to send your questions in, and you can do that via chat, or you could also, if you'd like, do it directly if you unmute and ask a question verbally, but chat might offer the best opportunity. So so please feel free to open your questions here. I have one here. Well, actually, I have a whole bunch, but I'm not, take over all the time here. Again, I can only imagine the challenges that the department has faced with redirecting the efforts of 1,000 or more staff away from their other duties, which are also critical for public health. That said, sometimes problems can create opportunities. And are there any things that you've seen that has come out of this that you might view as opportunities, and changes, for example, that may have taken place in how you operate that you might carry on into the future?
I can lead us off, Myra, and you can certainly fill in. I think, Randy, you are spot on. There's just been tremendous, this has created tremendous opportunities that I think we will continue to work on into the future. What I'm involved in often on a daily basis is, how do we serve the underserved in our communities? And a great example of that, again through partnership, is mobile vax sites with refurbished MTC buses, and some healthcare provider partnerships there as well, going out into communities and serving those focused on underserved populations, which we know are more impacted by COVID-19 due to a number of different factors. So that kind of opportunity, I think we will continue to foster and grow. And I think, again, back to, as Myra said, some of the data improvement areas, looking at, and again, COVID has provided that opportunity. The health department historically has gathered a lot of information on the public's health, not necessarily the individual's health, but in an aggregate kind of way. And this has shown us different ways that we can take that data and then make that more accessible and available. Again, from the standpoint of kind of helping with promoting the cause of health improvement as we move forward into the future. So I think, just as an organizational component, that was a little kind of diffuse within the agency, and COVID has really kind of brought that concept together to kind of bring data management under, I'll say, one roof, more so than when you got an agency of 1,600 people, 1,500 people, and 6 large divisions. That information could get diffuse and lost in discussions, and I think this is a way to kind of bring that together and keep that opportunity in front of us of how to share that information out with the public. Now, Myra, you got others?
Yeah. The only thing I would add to that is just as an organization, we financially haven't been able to keep up with a lot of our IT infrastructure, which then impacts our partners and then the ability to share data. Previously we've had a lot of faxes moving around. It's kind of common in the medical arena, and then also sending data to the state, and then obviously that causes a lot of issues. And so I think COVID has really highlighted that as an issue, and we have some opportunities to improve that infrastructure. We've already started to move from probably the 1980s in technology in some cases, maybe 90s, to the 2000s now. And my division in particular, we went live with a new database in that section 2 weeks after we had our first case of COVID, and I could not be more thankful. It took a lot of planning and effort, and I think a lot of other areas recognize that need and the opportunities that come along with that. And then also connecting data, right? We're very isolated in some of our databases because of how we're funded and how that infrastructure was built, and that connections will allow us to do more outreach and how we do our work. I'm also very encouraged by how quickly changes can be made when there's some pressure on us. So I'm hopeful that that will continue as well.
Oh, thank you, Myra and Tom, both. I'm just monitoring the chat session here, and share the chat that just came in, the comment. I've loved your consistent data display on your website. It's been very helpful for local decisions. The county reporting was particularly helpful to have granularity about information. You mentioned lack of pipette tips becoming rate limiting on some of your processes. We inventoried and volunteered those kinds of resources to our local hospital. How can we improve movement of supplies and resources as needed?
That's
Thank you.
a work in progress for this whole pandemic. What's interesting about pipette tips is every pipette, like automated pipette, has a different type of tip. That's fun, which makes it also more challenging. So one thing that we as a state have done is, and it's actually fairly unique, which I didn't know because it just seems obvious, is early on we formed a testing command center. So that was all of the clinical labs in the state were part of a group to talk about these types of things. Supply inventory, how to get testing needs distributed amongst honestly competing labs. One thing that we could do is really just continue to have those groups meeting, and for supplies, when things are in critical need, kind of communicating out with vendors and different organizations. It's a difficult aspect of this response, and just operating a lab, and if you don't know somebody else that has a supply, you're not going to get it, right? And so I guess a way to improvement is these relationships and build those over time. And right now it's a different state of affairs where we have a huge inventory and we can distribute those as needed. But in normal times, it's really having those connections with the industries.
Yeah, go ahead.
Me?
Yes.
I'll talk. All right, I have a question. For me, it's kind of hard for me to understand the amount of pushback that people have towards even getting the vaccination, the COVID vaccination. And so I'm curious about data that you might have, or corollaries that you might be able to share between, say, the polio vaccination of the 50s and just our annual flu shots. What kind of resistance do you see? Is this abnormal? Do you find it abnormal, or is it totally normal to you?
Yeah, Dave, that's a great question. And for those who are unfamiliar, and I don't know all the specifics, but have talked to my mother-in-law, who recalls back in the 50s or maybe even late 40s, there was a pretty tremendous polio scare within the country, to the point where they basically didn't have summer, or didn't have school during certain portions of that particular issue. Great, we were able to develop a vaccine for that that was really successful, and we're able to institute that and have success with that. I think we know a lot, and I don't know the specific numbers of vaccine uptake for the annual flu. It's probably not as high as any of us would anticipate it should be. So I'm going to say it's probably in the, and this is just a shot at, my guess is somewhere in the 40 to 60% range, if we're lucky at the high end. It's a communications thing, from the standpoint of, I think, as you see in the numbers of vaccine rates, even here in the state and nationwide, there was a very eager upfront group that really drove us quickly to where we are. And now it's going to become a real, I don't want to say a slugfest or a slogfest, but it will take a lot of effort to move us up into, and we have to admit, even at this point, we don't know where community immunity really stands with COVID. There are some diseases where at 80% that suffices, and others where it needs to be up at 90 or 95%. To get us up into those types of numbers is really going to be a real focused, and I'll say local connection kind of effort to, whether it's the doctor or some community leader or even family members, really encouraging, and I'll say, again, back to the data and how do you communicate it, debunking a lot of the myth that has grown up around this vaccine as we move forward. you know, again, it's a real communications challenge, and we are working on efforts to do that, knowing that there's a lot of work to be done there.
Thank you.
Okay, additional questions? Well, I do have another one. We talked a lot yesterday about some of the difficulties, I think, in including underserved communities and meeting our hopes for inclusion and diversity. And I know that at the Minnesota Department of Health, in public health efforts, science, technology, engineering, and math are all involved in, of course, the work that you do there. Can you comment briefly, we've just got a couple of minutes left, on any challenges or efforts the department is making towards being more inclusive, towards bringing underserved communities or communities that haven't had opportunities in STEM in the past into working in public health? Sort of a big question, but any quick comments?
Myra's looking at me like I'm going to answer this one. So
I can start.
yeah, why don't you start, Myra?
Yeah, so one thing that we at least at the lab, and I'm just going to speak for us for right now since I'm the deputy incident manager. We have been specifically working with different universities than we have in the past that come from a sometimes different background. A lot of the work that we do does require at least a bachelor's degree. And so we've also been looking at that to determine, you know, is an associate's degree going to be, if that background is going to be acceptable or not as well. And so we've been trying to do different sorts of outreach, reaching kids younger, high school. I've been talking already about even reaching middle school, having tours of the lab to show them the work that can be done and the career paths that are available. We've been doing a lot of internships during this pandemic, which has been greatly successful. We've had a lot of different backgrounds able to come in through those opportunities that we, at the state, a lot of people stay here for their careers. And so we don't have as much turnover as other businesses. And so that makes it also more challenging to get a different workforce in place. But we are working to encourage that at both the high school level and starting even lower to so that they're, as Tom mentioned, I didn't know anything about public health until I started at MDH. I knew it was a thing, but that was about all. So just really doing more outreach and communication to reach different populations.
Well, thank you both, Tom and Myra, again for the presentations this morning. I'm afraid we're out of time now for this session. So thanks everyone for joining us for this morning's opening session. And we'll now take a brief break as we transition to the next session. We invite you to return to the main event in Canopy, where you can chat with other attendees or view video on demand content or have a meeting with another attendee. Or you could visit the sponsor pages or more. So, and then at 11:30 a.m., please click the session for the STEM and Health Equity session to join the meeting. And so, again, sorry to cut the session off. This has been very interesting, and thank you everyone for your participation, but particularly Tom and Myra. So see you at 11:30.